wonderful presentation today from two of the folks that work tirelessly with the United Spinal Association. And we have got Annie Streit and Steve Lieberman with us. And they're going to be talking about basically from an advocacy standpoint, the United Spinal Cord Association and what they do and how we can all work together for the commonality of what we're all fighting.
I'm Steve Lieberman. I'm the Senior Director of Advocacy and Policy with United Spinal Association, representing our 5.5 million folks around the country who use wheelchairs for one reason or another, or maybe you don't. Maybe you've maybe use some other mobility device. Maybe you have some other physical disability. Whatever the case, the work that we do is, in my view, universal. So much of the work that we do helps everybody, and we're trying to get as many folks as possible to join up with us in all the work that we're doing. So we're really excited to present to you, and I'll hand things over to Annie.
Thank you, Steve. I'm Annie Streit, the Grassroots Advocacy Manager at United Spinal Association. I've been at United Spinal for a little over 4.5 years. I work with Steve, like he said, managing our registered advocates all over the country and help run the various opportunities we have for our advocacy program. This is one of my favorite things to do, is to go out and talk to groups. So I always enjoy this. And I'm also a power wheelchair user for almost 20 years from a diving accident. I had a spinal cord injury, so C5 quadriplegic. So I kind of had a viewpoint from that angle also. And I guess we can go ahead and get started. We're going to be talking about advocacy, how you can get involved, important aspects of it, and then what we provide through our advocacy program at United Spinal. Let's see here. All right. Why is advocacy important? First off, what is advocacy? And it's acts of public support or recommendation of a particular cause or policy. And through advocacy, communities like ours are able to raise awareness, break down barriers, and help further the causes that we really care about most. And effective advocacy really shapes the public debate on social issues and ensures that communities really have a voice in the policies that impact our lives. And here I've listed why advocacy is important: raise awareness, break down barriers, shape public debate, have a voice in policies that impact our lives, power to influence and advance change. I always say I was an advocate before I was an advocate, because I was always out there talking about my injury. And later on, we'll talk about the importance of advocacy and personal storytelling. As a grassroots advocate, you have the power to be heard by decision makers, educate policymakers, defend your safeguard your rights, share your personal story and experiences, show support for or against legislation, build influential relationships, advise and be considered in life-affecting decisions, and be part of a positive change. I'll hand it over to Steve for this one.
Thanks, Annie. So I've been with the United Spinal 5.5 years now. But prior to that, I spent 10 years on Capitol Hill as a staffer in the Senate in DC. So I've seen things from both sides. I've both met with staffers, and I've also been a staffer meeting with advocates. So I know a little something about what makes an effective advocate and how you are able to create change and to persuade the policymakers and the folks that are making decisions about how they're going to be on your side, why should they support you. So from my experience, the best advocates are pesky without being rude, and meeting with staffers for these policymakers is essential. Um, they need to hear from folks directly. And folks need to understand that it's both up to you to convince the staffer and up to the staffer to convince their bosses. We got to work with them. And I know from experience, having been a staffer, every staffer for a member of Congress, any policymaker, they've always got two goals in mind: um, how to make their boss look good, but also how to make themselves look good. So if you've got folks coming in to meet with um, a member of Congress that they from their home district, their home state, um, they're always going to be looking for, well, how can I get my boss, the person I work for, to stand out on an issue, to take the lead on something, to be able to say, well, I led on this letter, or I led on this bill, or I heard this issue from my constituents and I turned it into something and I solved the problem. Um, if a staffer can find something like that to be able to say that they took the lead, that makes them look good just as much as it makes their boss look good. So um, working with the staff is essential as we're trying to get things done. Following up with the staffer after we meet with them is also important. And then getting as many people to call and send emails as possible about that issue from back home. And I got to tell you, that is maybe the biggest factor for these policymakers is, what do the folks back home think of this? Are they taking the time to send me a message about this issue? How many people are sending me a message about this issue? Is it just one? Is it 10? Is it 100? The more folks that communicate with policymakers about an issue,
Oh,
it speaks volumes. So it's important to email and to call about these issues when they come up. If you have any deadlines, make sure you know what they are. Sometimes there's gonna, like if there's a letter that's being circulated by a congressional office for other congressional offices to sign on, make sure you know what that deadline is. And also know when to pull back. Don't burn your bridges. When we're conducting advocacy, it's always important to want to continue the relationship with congressional office so that you can try to continue to win them over to your side. I have there was one time when I was a staffer and somebody had been calling and calling about a particular issue. They were very passionate about it. But then one day they got over the top, too passionate. They started yelling and cursing at the young staffer, barely out of college, who was answering the phones. And that person doesn't have any power to influence anything. It's the legislative staffers that do. But we had to get on the phone with this person and tell her, sorry, we can't support your bill because of how you treated our young colleague. So make sure to always remain courteous when you're presenting the issues to those folks in the congressional offices. So there's different methods of advocacy, and it's important to understand that different advocacy tools work best in different situations. So there's direct action, so that's protesting, in the disability community, famously, folks have been pulled out of their wheelchairs, they've laid in front of buses, and that works sometimes, but it doesn't work every time and not for everything. And there's legal advocacy, so using the courts to try and win victories, on important rights and issues. But that takes a long time, and it's not always successful. But then there's legislative advocacy, where we come together to communicate to our policymakers to create change, using the power of the legislature, of Congress, or in the states at the state legislative level. And we believe in, with United Spinal, the comprehensive legislative advocacy approach. It works, and I've seen it work. Um,
Are you on a video?
but it's worked probably more often with other successful movements across this country. So the civil rights movement, the labor movement, environmental movement, cancer research funding, groups that understand that sending as many emails and making as many phone calls from as many constituents as possible makes the folks who are making decisions take notice. They see how many people are communicating with them. And it's a huge factor in determining whether or not they're going to support what we're trying to do. So those emails and phone calls, doing scheduled small group meetings with lawmakers and staff like United Spinal does on our Roll on Capitol Hill or Virtual Advocacy Day, and we'll talk about those in a bit. Doing follow-up emails with the staff to make sure that they know we're not just a one and done. We're not going to come in and meet with you once, and then you're not going to hear from us again. We're going to keep nudging you, and we're going to keep on you to support what we're trying to do. And the emails and the phone calls, getting as many from back home as possible, they amplify the effect of the meetings. So when and I know this because it's what I did, when you go back to your desk and you review your notes from the previous week, and then you look in the mail system, every congressional office has their own constituent email system, and you look and see how many people have written in about this issue in the past week, in the past month, in the past year. You're able to look at that and track it. And it's important when you're trying to decide, okay, how am I going to use my time and what am I going to support? And should I take the time to write a memo about how we should support this issue? So it's incredibly important. So this strategy relies on getting as many people in the community as possible comfortable with sending emails to their elected officials. And it's so easy to do. So why is it so important that we show up? And that's I can't believe looking at that now,
The
having
young Steve.
yeah,
Yeah.
having just turned 38 the other day, and I get increasingly more gray all the time. I'm looking at that and I'm like, where did I go?
Hey, we all
Uh,
think that. Hey, we all think that. What happened to all of us, right? We're living life and enjoying it. That's what we're doing.
yeah.
Thank you. I didn't mean to interrupt, but I just had
No, thank you so much. I do appreciate that.
yeah.
Congressional offices are fast-paced environments, and so the staff really only pay attention to groups who engage their office directly. They place a lot of importance on hearing from their constituents. So if they only hear from United Spinal or any other group once a year, they'll see us as a box to check and not think about us the rest of the year. And I know because that's what I did. We need to stay engaged throughout the year to demonstrate our commitment that we really care and these issues are really important. Annie, I think this is you.
This is mine. Thank you, Steve. Political engagement. Effective advocacy starts with clear communication and being prepared and being orderly. In-person visits, you build a long-term relationship with elected officials, want to get to know their constituents, which is what Steve has been talking about. Information is power. Sharing reliable information is a powerful tool in establishing trust with members of Congress and their staff. And be yourself and always be at your best. The way you approach, interact, and follow up with members and staff, it's really important. It's as important as the message you want to deliver. There's also town hall meetings where you can connect with legislators in your local community, and it's a great way to engage in person with your elected officials. And at these town hall meetings, you have to make your mic time count because you want to be prepared Share personal stories and always be respectful. Sometimes town hall meetings can get heated, but with it, and attendees feel strongly about an issue. So you always have to remember, like Steve said, don't burn your bridges, keep your cool, and being prepared really helps with that. And then there's social media, which is a great way to collaborate and reach a wider audience. All right. Effective personal storytelling. It's funny because I have a quote for this, and it's from the great Steve Lieberman that I share. I'll read this quote. It says, stories are the most valuable currency on Capitol Hill. Members of Congress and their staff are able to use them in many different ways. They can use them in a speech to highlight an issue, or they can use them while asking questions of witnesses at a congressional hearing. They can use them to plan events back home where they may invite that person to participate. Stories make an issue feel more real and personal in an environment that is awash in data points and funding figures. This is why it is essential for our community to share our stories with our elected officials and their staff in order to provide the disability perspective that is too often lacking in the halls of power. So again, personal stories, we tell our advocates that are new to this and maybe a little intimidated about going into these congressional offices is simply tell your story. Nobody knows your story better than you. It helps you relate. You can find ways to connect, hopefully, with the staff or the member of Congress. So we always like to do that. And like I said, I shared my story and did speeches before I was with United Spinal, so I was advocating when I didn't even realize it. So again, just share your story, especially when it relates to the issue at hand, when we send out action alerts to try to engage our members of Congress. All right, that's yours, Steve.
Right. So how can we apply these lessons for United Spinal and the broader community? We need a critical mass of consistent, engaged advocates in every congressional district around the country. We know that there are folks with disabilities in every community, and there are folks representing every community. So they need to hear from the folks that they represent in order to understand the challenges and the needs of the folks with disabilities in their communities. We need constituent ambassadors who can provide the disabilities perspective for elected officials if they have questions. Because by and large, the folks that get elected to office, for the most part, they don't have disabilities. There are more folks getting elected now that have disabilities, but when you're talking about a quarter of the population having a disability, there's not a quarter of the population of Congress or the state legislature that are folks with disabilities. So they really need the community, folks back home, to tell them what's what. By applying consistent pressure and by cultivating relationships with congressional offices, we gain allies on Capitol Hill and achieve better outcomes. And that's a fact. So what have we done at United Spinal to go about this, to communicate with our elected officials in the numbers that we need? We created our Grassroots Advocacy Network. And this started back now almost 5 years ago with just a few folks. And we started at absolute zero. We didn't roll anybody in from any prior lists. We didn't assume that anybody who had participated in any other advocacy efforts or subscribed to newsletters or anything. We started at a blank slate and said, who's interested? Who wants to participate and make change for our community? So, starting in 2020, gathering just, a few folks to now where we have over 2,500 registered advocates, all opt in. Everybody has to sign up for themselves. Over 2,500 folks today in all 50 states. In 433 of the 435 congressional districts, we have advocates. Only 2 districts where we don't right now are, there's a couple in California. We're constantly looking for more folks wherever they live. So, you know, we're looking for as many folks as we can get to sign up and advocate with us. Because, you know, as we said, we don't represent just folks who are spinal cord injured. We don't represent a small subset of folks. We represent everybody within our community. And we're constantly looking for more folks to join up with us. And we've got a lot of things that we're doing, and we're going to share the rest of that with you tonight. Annie, next slide.
Thank you, Steve. And yes, now we're going to get in more of the advocacy program and the various opportunities we have. And the first is our monthly virtual advocacy live. And we actually just had it today for this month. These fall on the 3rd Tuesday of every month, and we alternate the times between 1 and 5 p.m. Eastern time, just so we can accommodate our West Coasters. You know, and Steve and I, we co-host this event, and it's advocates from all over the country that come and join in. I believe we had around 65 advocates that joined today. And it was a great conversation. It probably could have gone on for a lot longer, but we had other meetings. And we, you know, it really provides an opportunity to stay updated on what the issues are, and what advocates are currently focused on. And there's no agenda. We wanted it this way. So advocates can just come in, and Steve and I, we try not to do a lot of the talking. We want our advocates to come in and just kind of engage with each other and collaborate on what they're working on. And many times an advocate in California has really helped out on an issue with an advocate in Florida. So it's just our way to try to connect everybody. And our next two, the next one will be March 18th at 5 p.m. Eastern time, and then April 15th at 1 p.m. Eastern time. And there's these links to register. And then once you register, you don't have to register in the future. It automatically registers you for the future advocacy lives. So we would love for you to join. It's always great conversation. And we've got a lot of our working groups came about from discussions in Advocacy Live. Next is Meet an Advocate live stream. This is something I started pretty much when I started at United Spinal. And what I do is approximately once a month, I select an advocate I've had advocates from all over the United States and highlight what they're working on. And, you know, some of these advocates, I'm so glad that I started this, because I've met so many people. I've probably done over 40 to 50 of these, I believe. And my whole goal was to highlight what they're working on, because a lot of times the disability community is not aware. And what makes this event special is it's live, and you can watch it live, which allows you to ask questions live. So the next one is actually tomorrow at noon Eastern time, and it streams directly over there on the right. I listed. If you're on any of those social media pages at noon tomorrow, it'll pop right up and start going live. And like I said, you can ask questions, you can comment. We provide a lot of different information. Shantae, she's Miss Wheelchair Michigan 2024, an amazing speaker. She does a lot of peer mentoring, and she is very well-versed in care support, because before her injury, that was actually her, I think her title was Director of Care. She was injured at work, got a spinal cord injury, and now she is needing care. So she's been on both sides of it, and has great information to share. So I'm really looking forward to that. And then there's a link there also, if you want to kind of flip through all the past live streams, we have an archive on the website that allows you to do so. next is advocacy resources and toolkit. We have an advocacy resources webpage that we've been slowly building as we're creating more resources. And I've listed kind of what's available now. And the link for the resource webpage is there. We have our advocacy in action. It's a toolkit for the rolling revolution. And it's 60 plus pages full of information. It gives background of advocacy, defining advocacy and key legislation, the legislative process, creating effective storytelling. We highly recommend that you check this out if you're going to do something like our Roll on Capitol Hill, or you're trying to create events or a roll on the Capitol in your home state. This is packed full of information. Next is the advocacy program guide. And this was something we put together, I believe, last year. And what this is, it contains everything you need to post to social media or provide information about how to register for the advocacy network, about our working groups. They're just templates that you can copy and paste. You may have to change a little bit of information, and then either for emails, for newsletters, wherever you want to put that information. We just tried to create this guide to make it easier for our members to post and share information to recruit more advocates. We have our state and local advocacy menu. This is something that Steve and I put together, and it's literally looks like a menu. And it's just suggestions for actionable advocacy initiatives. We did not make this to push any ideas on our advocates. We wanted to empower them and give them an opportunity to look through a list, and maybe they can look through that and be like, oh, this is a good one to work on. So that is ever changing. I always like to say, if you look at that and you don't see something on there that you think should be on there, to let us know. And I actually need to go in there because I haven't looked at that for a little bit. So that needs updating, which I will do. But we really like that, and it's a really good resource for our advocates. And then lastly, we have the advocacy curriculum module 1 called Why Advocacy. And this is available. What it does is it introduces you to advocacy and why it matters. It will cover the goals of the curriculum, the background and mission of United Spinal, and the Grassroots Advocacy Network, the various forms and methods of advocacy, important advocacy wins through the years, and then reasons for getting involved with federal, state, and local politics, and then key advocacy terms and definitions. So we like to always present this. If you're new to advocacy, it's a great way to kind of dip your toes in and kind of see what it's all about. And it only takes about 20 to 30 minutes. It's very interactive. We wanted to create that in a way to keep interest, and so people can actually learn about that. And then also on this advocacy resource page, you can find our working group resources, which I'll talk about here in a little bit. All right, Steve.
So we mentioned Roll on Capitol Hill. This is our annual event that we bring a whole bunch of advocates from around the country to DC to meet with their members of Congress and staff. And we are holding it this year in June. We're still working out exactly what we're going to be advocating on, because things are shifting and moving around. And but I mean, usually we talk about things related to healthcare, related to transportation, related to issues that are important for our community at large. We've been talking about things like wheelchair repair, about the need for improving paratransit, about making sure that Medicaid doesn't go away. So we'll be doing that in June, and we're bringing folks from around the country to participate in that. And then we've got our virtual advocacy day that we're doing next month, which, since it's all virtual, doesn't require as many logistical hurdles for us to deal with. But we do this in March so that we can get our priorities for appropriations. So those, what do we want the federal government to spend money on specifically? And we have specific items that we talk about, namely are the Spinal Cord Injury Model Systems Program that gives money for some of the best rehab hospitals around the country to serve as model systems, and they're really the gold standard for rehab, research, and continuing care for folks with spinal cord injury. But their funding's been stagnant over the last quarter century, so we've been trying to help them get more money because they need it.
Next are working groups. We've been running these working groups for some of them for almost 3 years now, I believe. We have, was it 3 years, Steve?
Yep.
Yeah. And we have 5 different working groups: accessible parking, outdoor access, emergency preparedness, care support, and accessible transportation. And all the smaller things underneath each one are all the resources that our working group members have made. And what we do is during these working groups, we kind of decide on a topic, and the working group members share their experiences and information and resources related to that topic. And then I combine everything to make a resource. So we've been very busy with this, and we're getting quite a collection of resources. So we're really trying to focus on outreach now and getting these resources out in front of eyeballs. We want people to see them. And like I said, you can find all of the working group resources at the link at the bottom on the Advocacy Resources webpage. And if you're interested in participating in any of these working group resources, there's a simple online form. I also have the link there. And you can join one, you can join all. It's however involved you want to be. We understand you might not be able to make it to every meeting. They meet once a month, except accessible transportation meets quarterly, just due to bandwidth and time. So we're really excited about these working groups, and I'm going to talk a little bit more about the top one, accessible parking. So Steve and I were excited about this year because we've worked hard on putting together this complete guide to accessible parking, and we have our 2025 year of action on accessible parking. And to download this, you can download it for free. You can visit our accessible parking webpage, which is there. And we're really wanting people to download this, to share it, again, to get it out in front of many people, organization, entities as much as possible. And part of our 2025 year of action, we're using data that we collected from the help of a wonderful intern who did a lot of work for us. We've collected enough information on 20 states to show that we need to update the minimum number of accessible parking spots in parking lots across the country. And on that accessible parking webpage, you can see the data we collected. We have some graphics. We have kind of a one-pager. There's a lot of information on that webpage that I highly recommend checking out. Now, this complete guide to accessible parking, it provides comprehensive information, including key terms, different types of accessible parking spaces, the process of obtaining and using an accessible parking permit. And it also goes into things such as accessible parking etiquette, public education initiatives, strategies for enforcing accessible parking regulations, and preventing fraud. So it is jam-packed full of information. And again, very easy to download. You just have to fill in a little bit of information and it's all yours. And another thing we want to focus on at the state level is kind of 6 topics. I have them listed here: state driving exams, placard fraud proofing, law enforcement empowerment, private lots and garages, access aisle signage, opposing increasing eligibility without increased minimum accessible spaces, and encroachment crackdown, which that also includes, electric vehicle chargers, curbside pickup, various different things. So, as you can see, I have a few pictures posted there that advocates have sent me of, different instances where people are violating the accessible parking laws. So, our hope is to make these changes, and we all know that we need more accessible parking spots. That's something that, people don't usually argue with us about. So we're excited for this upcoming year. All right, Steve.
So what are our expectations? And we're gonna put the link to fill out the sign up form for our Grassroots Advocacy Network in the chat. But that QR code, if you scan it with your smartphone, will take you to the same place. We want every advocate to participate at their own pace. We recognize that everybody's got their own amount of bandwidth, everybody's got their own amount of time, everybody's interested in different things. We're not out here trying to say everybody's got to do this, everybody's got to do that, everybody's got to spend X number of hours a month or whatever. We don't do that. So if you just want to get our emails and our information, and when we send our action alerts, you just take a minute to send those in, great. If you want to join us for our Advocacy Live sessions, or any of our working groups, great. If you want to join us for Virtual Advocacy Day or Roll on Capitol Hill, great. You want to do everything or just a couple things, we make it easy for folks to participate in whatever way they want, as long as they care about the issues that folks with SCID and any and all folks who use wheelchairs for any amount of time or any mobility device. As long as you care, you don't even have to be someone who is a wheelchair user. You could be a family member, you can be a friend, you can be a clinician, you can be a colleague, however, if you just care because you care, anybody and everybody can participate, and we welcome everybody with open arms. So, we're always looking for more folks to join us and add to the conversation. And we make it really easy for folks to participate in whatever way they wish.
Finally, thank you. We appreciate very much you giving us this opportunity to present and talk about. We really put a lot of work into this, and anytime we get a chance to talk to groups, we truly enjoy it and truly love trying to spread the word and get more people involved. I have emails here. The first one, if you email advocacy@unitedspinal.org, that email will go to both Steve and I. And then I also have our separate emails too. And then the link to the United Spinal Association, the advocacy program, which pretty much is everything that we talked about today, you can find on that page. And I think that's it.
Oh, no, that's not it.
Oh,
Because I'm sure we have some people that would be very interested in asking some questions. So you guys
yes.
are able to take some questions. Well, I have a couple of comments before I call on questions. So you guys start thinking about your questions and hit that little raise your hand thing down there, and it'll put my screen in order for me. Or you can, add them in the chat, but we'd love to hear your questions. So get on board with what your question's going to be. But I was really curious about your work with Capitol Hill, because we've recently come into a partnership working with a platform, and we've launched our first ask as a foundation. So we are really very much on the cusp of what you guys have been working with now for a long time. So I'd like to find some way where we might can work together on some of those issues. And then also I'd like to point out, I wonder, because most of my population that we're dealing with HSP or PLS, a lot of our folks have wheelchairs, devices, all of the disability issues that you can imagine. And I'd be curious of your 2,400 that's members working with you guys, how many of those might have HSP or PLS? Because we would love to try to find a way to partner with those folks.
Yeah, so let me try and unpack some of these parts here. So of course, we'd love to work with you all in whatever manner makes the most sense in terms of, your asks and action alerts and so forth. And I know they are important, and I don't know what platform you all are using, but I can tell you they do get seen by the congressional offices. Some are more responsive than others. Some care about reading those messages more than others. It's important to get as many folks as possible to send those in, because that's how they use different systems to they run what's called a campaign search. So they're able to group the messages that have similar language together. So, and they're able to adjust, okay, this message has 70% of the same words in it, or this one has 50% or even 30%. And they group them together based on how similar the language is. That's how they're able to sort through them and assign a response to them. So the more of those get sent in, the better, because then they're able to, they don't have to go searching for them individually. They can be grouped together and it comes up, towards the top of what they're sorting. But when it comes to, how we can work together, we'd love to explore that for sure.
That sounds great. That sounds great. Well, I have got Tina and Tim over here as a question. Tina and Tim, you guys go ahead.
Well, I have a question. It could go for either one of you. PCA, primary care attendant or personal care attendant. Okay. Is that an official title, or could that be my husband? Because he does all the,
But he doesn't have a degree.
right.
Yeah. Well, I mean, your PCA can be whoever you want it to be, right? Now there are different rules that are out there in terms of, who can get paid to be a PCA, which a lot of times does not include a family member. We were able to, during the pandemic, get some of those rules loosened. But yeah, I know support for family caregivers is something that we've been working on for a long time, and something we definitely support.
Another thing I have is probably for Norma too. The 2,500 advocates you mentioned, that's just the advocates. That's not the members. There's like what, 20,000?
67,000 members.
Oh, okay. That's very good.
Yeah.
That's amazing. Okay.
Yeah, they're two separate. You can sign up for national membership, and then the Grassroots Advocacy Network registration is a separate sign up. So yeah, they're two different things.
Good. Well, I'd still be curious to find out how many might have HSP and PLS, because we certainly want them to understand that that's what we advocate for, and that we can all kind of blend together some messages. That would be wonderful. Miss
Yeah,
Stacey Fox, you got a question, comment? Go ahead.
Yes, I do. We had this is a question for, I guess, Norma, I don't know, Norma.
Just
We
say
had an SPF talks on a parking thing. I already have a parking app on my phone,
yeah.
but I wanted to know because they had a lot of people, they've been that, I don't know, that group if it's combined, so with theirs, because they have a lot of people. I don't know if it's different. The question is it different or the same?
These are different organizations.
Oh, okay.
Yeah, the gentleman that we had on as an SPF talks, if you guys recall, he was talking about the placards, and he was talking about where you can actually just write in on an app when somebody is parking in an ADA spot that really probably shouldn't be there. And you could take all kinds of photos about that and how he is, his license plate, and it kind of reports it. Is that what you're talking about, Stacy?
Yeah, but Matt Marsh is also a member of United Spinal, right?
Oh, he was.
Yes.
Okay.
Yeah, and actually, New Mobility,
Oh,
they just did an article on Mac Marsh and his parking mobility app. So
Yeah, that's
New Mobility is our magazine.
yes,
yeah.
Mhm.
So we're
So-
all working together, but they're different organizations though, Stacy.
I'll send that out
We're
to you.
working together. That's good.
yes.
Yeah, yeah.
And we over a period of really 3 years looked at the parking issue, every which way. Because we'd heard from our members consistently about the problems they were having with parking. So, the product of all those discussions was our parking guide, which has gotten an incredible response so far. And credit to Annie for doing a great job of putting it together and synthesizing all of our conversations over the last few years into, something that came out so well. But it is really a comprehensive guide to everything you need to know about accessible parking. And, we know what the issues are. The issues are there just aren't enough parking spots. Why is that? Because there are it's a basic problem of supply and demand. The percentage of spots that are supposed to be accessible parking spots are, depending on how big the parking lot or garage is, between 2 and 4%, unless you're at a hospital where it's 10%. But for most places, between 2 and 4% is all they're required to have. But there's close to 10% of folks on the road who have a placard or a plate. So what do? Got to increase the number of spots. So we got to increase the number of spots. B, we know that there's a general lack of awareness out there about accessible parking spaces and what access aisles are. Most folks don't know that striped area in between accessible parking spaces is called an access aisle. And it's there to allow folks who use accessible vans to put their ramp down and get out of their van from the side. And when that's blocked off because folks, they think, well, I've got a placard, so, oh, this is just extra space. I don't have to color inside the lines. Yes, you do. You got to color inside the lines. You got to park in the lines. You don't park in the striped off area. That's so folks can get their ramps down. So folks don't know that. There's just a general lack of awareness. So we know we need to raise awareness about what access aisles are, and the fact that no, you don't park directly in them. You don't park, part way in them. They're supposed to be clear at all times. And then, enforcement. There's a lot of folks out there who are using placards that shouldn't be using them. And we're not going to get into any kind of a food fight in terms of who's supposed to have them or not. But if you're not supposed to have them because you took it from your dead grandmother, or you're borrowing it from somebody, and or it's expired, we definitely have problems of folks who are using placards in a way that they shouldn't be used. And so how do we go about addressing that? We're actually working on federal legislation now, which we hope to get passed this year, so that the states can test out different things that they can try to try and go after placard fraud. Is there we don't really know what the best way is. Is it, do we, require there to be something that a law enforcement officer can scan to see if the person who is driving the vehicle actually is the person who has the placard? Is there something that should be affixed to the windshield? Should it be on the placard? We got to test these different anti-fraud elements, sort of similar to, what we did with driver's licenses a generation ago, where we, updated them to have, different elements to make sure that driver's licenses were legitimate. But we got to test that out, and then eventually we can issue some national standards on placards to make sure that they all have the same elements, and they can be used across state lines easily. But for now, we got to test those out. So this is an issue that I think folks get, they understand. It's right in front of everybody. When you drive around, you see the accessible spaces. But there's a lot of education that needs to take place. So, we're just trying to move the needle on an issue that I think for a long time had sort of, flown under the radar.
I absolutely agree with you. It is so wonderful to hear of all the work that you guys do day in and day out, and the things that are going on with the United Spinal Association. I greatly appreciate that, from the participation of knowing what we have to deal with, and the issues of mobility and disability. And so thank you guys very much for all of that. Annie, any other thoughts you've got?
Well, thank you. Thank you again for having us.
Yes,
And-
thank you so much.